Welcome back to Revenue RX, the podcast at the intersection of pharmacy and finance. I'm your host, Lubna Mazen. Today, we're talking about one of the biggest hidden threats in healthcare finance, revenue leakage. There's a famous song by the Police that says, "Every breath you take and every move you make, I'll be watching you." Most people hear a love song. Others hear a restraining order. Pharmacy revenue cycle leaders hear revenue protection. Reimbursement is tied to every step of the process. Every handoff, every click, every work queue, and every required documentation. And when one piece breaks down, revenue disappears long before anyone realizes that there's a problem. Your job as a pharmacy leader is not just to generate new revenue, it's also to protect existing revenue. Today, we're walking through some of the highest risk points for pharmacy revenue leakage, and we're doing it backwards, starting at the end of the revenue cycle and tracing back where along the revenue cycle revenue can be lost along the way. Let's start with reimbursement. Revenue can be lost simply through delayed billing, slow follow-up, payer lags, or missed appeals deadlines. And when you're dealing with payers, persistence is not optional. One of the largest overturned denial trends I worked on through my career took 3 years to resolve. Yes, you heard that correctly, 3 years. We had to bring the same claims to the payer every single month for follow-up for 3 years to get resolution. Revenue cycle teams cannot rely on memory or spreadsheets alone to manage this level of complexity. You need infrastructure. Personally, I highly recommend building in your EHR a denials work queue, something that's dynamic and automated and live, unlike Excel. Don't get me wrong, any tracking system is better than nothing, but something that's built in your EHR will allow you to track status update, escalation history, and payer responses all within one place. In this process, timing truly matters. So by setting up denials work queues that have appeals timelines and or pre-scheduled follow-ups will drastically improve your follow-up with the payers. Different payers have different appeals windows, reconsideration periods, and filing deadlines. If you miss those deadlines, the revenue loss is often permanent. That's why denials work queues are time sensitive. One strategy that worked well was assigning prioritization scores based off of appeals deadlines and financial impact. But reimbursement issues cannot sit in silos. If your denials team is housed outside of pharmacy, you need a rapid escalation pathway connecting pharmacy revenue cycle, patient financial services, and payer contracting teams. One best practice is establishing reoccurring touchpoints, including weekly meetings with patient financial services, the prior authorization teams, and payer contracting leadership. This allows you to have one place where all the key stakeholders are at the table. You can quickly assess different claims and escalate as appropriate. High-performing organizations treat denials as actionable intelligence, not downstream cleanup work. They study them, trend them, and use them to redesign the workflow upstream. Now let's move upstream into coding and charging integrity. When organizations first build pharmacy revenue cycle infrastructure, coding errors are often the highest risk and highest reward opportunity category. This is because even small errors at scale create enormous financial exposure. Common issues in this area include incorrect NDC to HCPCS crosswalk mapping, quantity discrepancies, missing modifiers, incorrect billing units, charge router failures, incorrect charge router mapping, and HCPCS and pricing updates are not implemented in a timely manner. The dangerous part is that many of these errors are invisible until you audit for them. This is why coding governance matters. Coding must be centralized, continuously maintained, and routinely validated. As organizations mature, coding becomes less about crisis management and more about routine auditing, surveillance, and testing. Pharmacy leaders cannot simply assume that a system is functioning correctly simply because claims are going out the door. Claims may still be incorrect, which is why assessing your reimbursement is truly important. Incorrect claims create denials, underpayments, compliance exposure, and revenue loss. Revenue integrity requires ongoing monitoring, not just annual cleanup projects. Next comes documentation. Incomplete or insufficient documentation is one of the fastest ways to create denials, delays, and underpayments. And unfortunately, many organizations underestimate how specific payer requirements have become. Areas of inappropriate documentation include missing route of administration, missing infusion start and stop times, missing administration complexity coding, and insufficient medical necessity language. All of these directly impact reimbursement. Strong documentation requires operational alignment between providers, pharmacy, nursing, and revenue cycle teams. One strategy I strongly recommend is building smart phrases or smart notes that tie directly to payer requirements. Essentially, embedding reimbursement intelligence into the workflow itself. The easier you make compliant documentation for frontline staff, the more consistent your reimbursement outcomes become. The goal is not to create more clicks. The goal is to reduce ambiguity. Then comes prior authorizations. If there's one area where organizations lose revenue the fastest, it's this area. Missing, expired, or incomplete prior authorizations can significantly impact reimbursement. When site of care restrictions, medical necessity requirements, and payer-specific criteria are not evaluated proactively, organizations often face preventable denials, payment delays, and unnecessary revenue leakage. Unfortunately, this problem has only intensified as organizations adopt biosimilars, 505(b)(2) products, cell and gene therapies, and other emerging or novel therapeutics. You have heard me say this before, and you will hear me say it again. Prior authorizations are not an administrative task. They are both a function of clinical and financial assessment. Successful organizations operationalize prior authorizations strategically. This means strong payer policy intelligence, real-time benefits investigation, escalation workflows, clinical documentation alignment, financial clearance processes, and tight coordination between pharmacy, clinicians, and patient financial services. As you look across these risk areas, you probably notice something important. They're all connected. Weaknesses in one area cascade to every other area. A documentation issue becomes a coding issue. A coding issue becomes a denial. A denial becomes missed reimbursement. This is why pharmacy revenue cycle management cannot operate in silos. Cross-functional collaboration is not optional. It is foundational. Protecting revenue is not about one perfect workflow. It's about building an ecosystem where pharmacy, finance, patient financial services, contracting, providers, nursing, and operational teams together move the process forward. And the organizations that do this the best are not just improving reimbursement. They're building more sustainable healthcare systems. Healing patients is the mission. Protecting the margin is the strategy. This is Revenue RX. Quick disclaimer, this podcast is intended for informational and educational purposes only. The views expressed are my own and do not represent those of my employer or any affiliated organization. This content does not constitute as legal, financial, or reimbursement advice. As always, consult your internal teams before making any decisions.